Hi, I'm Dr. Marcia Sirota, and today I want to talk about two myths that people get caught up in around mental health treatment. So I have been seeing a lot of patients lately who are suffering unnecessarily because they have these beliefs, these false beliefs about mental health treatment. So I've seen many people who think that they need to tough it out when they're suffering from anxiety or depression or insomnia. They just tough it out for years, and they suffer unnecessarily because there are good treatments available for anxiety, for depression, and for insomnia, but these people won't receive the treatment because they won't ask for help because they think it's a sign of weakness to ask for help for your mental health. Well, your mental health is part of your overall health, and these people have no problems asking for help for their physical health. They take their asthma medication, their blood pressure medication, their thyroid medication, their diabetes medication, their heart medication, but they won't ask for help when it comes to their mental health because somehow that's a sign of weakness. Obviously, there are still stigmas around mental health and mental health treatment, but I'm hoping that in 2022, people can see that you deserve to get the help that you need, and you deserve not to suffer for years because you have mental health difficulties. So please stop toughing it out and go to your healthcare professional and seek the help that you need and that you deserve. Seek the treatment that will help you feel better so that you don't keep suffering unnecessarily. Now, the second issue that I have seen a lot around mental health is that people don't want to take medication because they have a lot of false beliefs about medications. First of all, again, they feel that it's a sign of weakness to have to take medication. But I tell them, you're taking your diabetes medication, you're taking your blood pressure medication, you're taking your cholesterol medication. Is that weak? Is that a sign of weakness? And they go, no. And I say, okay, so if it's not a sign of weakness to take these medications, it's not a sign of weakness either to take medication for your mental health. It's part of your treatment for your health. So people need to recognize that it's not weak to seek mental health treatment, and it's not weak to take medication for their mental health. It's just part of getting better, feeling better, and not suffering unnecessarily. Now, people have a few interesting myths in their minds about mental health medication. One of the first myths is that they're going to become addicted to the medication. Well, there are very few medications that mental health providers offer that are actually addictive. I personally usually steer clear from these medications because there are so many alternatives that you can give instead. So I give anti-anxiety medication that has no potential for addiction, and patients tolerate it very well. I also give antidepressants, which have no potential for addiction, and patients do not become addicted to these medications. So there are many medications that you can give which do not cause addiction. There are also many different medications you can give for insomnia that do not cause addiction. So you just need to have conversations with your mental health provider. Make sure that you request medication that's not going to be addictive if you feel that that might be an issue for you. Certainly, there are so many alternatives that no mental health provider needs to give you medication that's going to cause addiction. Now, the second problem with people around medication is that they think it's going to change their personality. They come to me and say, I can't take this medication. I don't want to change who I am. I don't want to change my personality. Well, the vast majority of medications that I offer do not change your personality. Antidepressants most often do not change your personality. Now, there are some occasions in which people feel very flattened and they feel emotionless on certain medication. In that case, they should not be taking that medication. One of the things that people don't do is they don't tell their doctors enough how they're feeling on their medication. And the other thing is they need to make sure that they communicate to their doctor that they would like to try something else. Because unfortunately, some family doctors don't have a lot of confidence providing mental health medication, not the way that psychiatrists would, for example. And so they might continue to have somebody taking a medication because they are not really sure that this person is unhappy on it. So the patient needs to advocate for themselves and say, you know what, I'm finding that this medication is really making me feel like not myself and I don't want to be on it anymore. Let's look for something else. I think if you say that to your family doctor, they will help you find an alternative medication. For the most part, antidepressants do not change your personality, but if you do find that you don't feel quite like yourself, there are certainly many alternatives. And I have found that switching a patient to a different medication can make them feel so much better, and they're no longer depressed and they feel like themselves. So don't just stick with the first medication that you try if it's not making you feel good. There are many alternatives, and sometimes, not often, but sometimes you might need to try a few different medications until you get the one that makes you feel really good without any undue side effects. My philosophy of medication is to give the lowest possible dose for the maximum possible benefit and the least possible side effects. And I think that should be a general philosophy for any kind of healthcare professional to help their patients feel better on their medication. Now, the third myth that I see with people who are on medication is they feel like once they start this medication, they can never go off it. And many of my patients ask me the question, do I have to be on this forever, doctor? And I say, you only have to be on it for as long as you need it. So my philosophy is you start the medication, you wait until the person feels better, then you wait a little while longer, and then you try tapering the dose and see how the person does. If they're doing okay, then you can taper them right off of it. And once they're off the medication, you observe them and see if they're doing okay. If they're doing okay, they can go off the medication. Now, they might have another episode of depression or anxiety down the road, and then they might have to start medication again, but they might not. However, some people, when you taper them off, they don't feel so good. Or when you stop the medication, they go back to being depressed or anxious. And those people are people who need to stay on the medication for longer. And you might want to try tapering them off down the road. And again, if they're not doing well, or if you stop the medication and they go back to feeling depressed or anxious, you have to put them back on it. So some people can go off it and they're fine. And some people go off it and they're right back to where they were. So why keep them suffering? Just put them back on the medication. So it's hard to know who's going to take the medication for how long. And I always say, which do you prefer? Feeling good or feeling bad? If you feel good and you're tolerating the medication, you're not addicted to it, it's not changing your personality, you feel well, then just stay on the medication and feel well. Some people have this myth that there's something bad about being on medication, quote unquote, forever. But they have no problem being on their diabetes medication forever or their cholesterol medication forever. Somehow being on a mental health medication, quote unquote, forever is a sign, again, of weakness or a sign of a failure. There's no failure or weakness being on mental health medication. It's medication for a medical problem. And if you feel well on it, why are you thinking about stopping it? So I want to explode these myths because I don't like to see people suffering unnecessarily. It's not weak to seek out mental health help, and it's not weak to be on medication. It's not a failure to have to take medication because you have to take medication for your physical health and you don't see it as a failure. So allow yourself to get the help that you need. Allow yourself to get the treatment that you deserve. Reach out to your family doctor or your mental health provider. Tell them how you're feeling, describe your symptoms, and most importantly, if the medication that you've started isn't working for you, whether it's not effective enough or you're not tolerating it, discuss it with your healthcare professional and either adjust the dose or switch to a different medication. There are so many alternatives these days. Just know that if you try to find the right combination or the right dose of medication, it's there, you'll find it, and you'll feel so much better. I'm Dr. Marcia Sirota, talking about these myths that people carry that really prevent them from feeling better in their mental health, and this is completely unnecessary. I don't believe that people should suffer in silence for years. I think that they should seek out treatment and feel better because life is hard enough and we don't need to be suffering from mental health that's being untreated.